The Chiropractic Medicare Coverage Modernization Act needs to be passed. House Bill 1610 and Senate Bill 799 have been introduced as companion legislation for this act. Chiropractic was originally included in Medicare in 1972 and only covers manual manipulation of the spine. This limitation decreases access and creates a barrier to care. Allowing chiropractic doctors to practice up to their state scope will increase access for Medicare patients to be treated conservatively with a non-opioid form of care. The legislation would add no new services or conditions that the chiropractic doctor is not already taking care of in their daily practice. It would only include a modernization of the chiropractic provider group to compete for dollars already being spent at a cost savings to the plan. This legislation would streamline the Medicare program and align it with coverage from the Veterans Administration, the Department of Defense, the Federal Employees Health Benefits Program, and all other private insurers. It would reduce the costs and treatment delays for the patient instead of requiring a referral to the family doctor to order needed diagnostic tests. This allows the chiropractic doctor to order lab and diagnostic tests quickly, as they do with every other insurance plan. United Healthcare found that when chiropractic doctors are included in a health plan, it decreases spinal imaging by 22%, decreases spinal surgeries by 21%, and reduces opioid prescriptions by 19%. UHC has found that including chiropractic doctors in the plan saves them so much money that they are now waiving deductibles and giving patients up to 3 copays for free. Since chiropractic doctors provide the same or better evidence-based spinal care for less overall cost, many experts believe the modernization will not cost additional funds at all. About 5,000 Medicare recipients per month experienced an opioid overdose during the first 8 months of 2020 during the pandemic. There are currently 62.6 million people on Medicare. Based on information from the Office of Inspector General, 1 in 3 seniors is on an opioid prescription. That equates to 20.8 million Medicare-covered patients on an opioid script for pain. Passage of this legislation could equate to a reduction of over 3,952,000 opioid prescriptions. The Office of Inspector General stated in a report in February 2021 that over 200,000 people have died from opioid overdoses since 2015. A September 18, 2017 letter from the Association of Attorney Generals to the President and CEO of America's Health Insurance Plan states, when patients seek treatment for any of the myriad conditions that cause chronic pain, doctors should be encouraged to explore and prescribe effective non-opioid alternatives, ranging from non-opioid medications such as NSAIDs to physical therapy, acupuncture, massage, and chiropractic care. The Joint Commission also agrees that hospitals should promote the use of non-pharmacologic strategies, including chiropractic care. They stated this in the Joint Commission R3 report published on August 29, 2017. The American College of Physicians also called for non-invasive therapies to be first-line treatments for lower back pain in new clinical guidelines in 2017. Optum, the health services subsidiary of United Health Group, data shows patients 70% of the time start with primary care providers and specialists to treat their lower back pain, compared to 30% who start with conservative care. Their data shows conservative care. Chiropractic, physical therapy, and acupuncture can save $230 million in annual medical expenditures. Chiropractic doctors are already being utilized by healthcare plans, including Medicare and Medicaid, as the first course of treatment for lower back and neck pain as opioids become a last resort treatment. Most chiropractic doctors currently provide physical therapeutic modalities, acupuncture, acupressure, dry needling, massage, yoga, rehab, and many other non-opioid treatments, including chiropractic adjustments, also known as spinal manipulation. Questions? Please contact the American Chiropractic Association at the phone number and email listed here. How can you help? Contact your federal representative and senator and ask for their help to support House Bill 1610 and Senate Bill 799. This is bipartisan legislation that provides patient access to all Medicare-covered benefits allowable under a chiropractic doctor's state licensure. This legislation appropriately defines a doctor of chiropractic DC as a physician in the Medicare program. Co-sponsoring now by your federal representative or senator is a vote for a reduction in health care costs and real action to help reduce the opioid crisis by preventing it one patient at a time.